Hi there, my name is Laura Schultz. I'm here today to talk about Bright Beginnings Nutrition. It's an education program aimed at pregnant women whereby participants will learn about nutrients required for a healthy mother and baby, foods that contain these key nutrients and how to prepare these foods. The goal is to reduce the rates of childhood obesity by reducing the incidence of excessive gestational weight gain in pregnant women. Childhood obesity is a prominent issue in Australia. There's over 1 million children and young people are overweight. These obesity rates pose major risks for poor short-term health, but also puts these children at risk long-term for chronic diseases later in life. Another big problem is the gap between socioeconomic areas and obesity rates. 34.7% of children are overweight or obese in low socioeconomic areas, and a much smaller 22.3% in the higher socioeconomic group. So, pretty big gap. The next stat that we look at is the number of obese pregnancies in Australia. It's actually more than tripled in the last decade, and there's a great 67% of women are gaining an unhealthy amount of weight during their pregnancies in the lower socioeconomic areas. So that's what Bright Beginnings Nutrition will be targeting. We want to help these women and see if we can make a positive start to the next generation of children. We think that pregnancy is an opportune time to educate women about nutrition. Clinical studies do actually show that women are more likely to modify their eating and lifestyle behaviours in order to benefit the health of their unborn children. And there's also a cohort study that found that mothers who adopt high quality dietary patterns are more likely to have children who also consume a more nutritious diet. We want to target in particular the Playford City Council area. It's situated 30 kilometres north of Adelaide in South Australia. Over 90,000 people reside in that area. And in 2008, it was actually ranked the third highest of the low socioeconomic areas in South Australia. So that's where we want to target our program. So we literally want to start at the very beginning. So when women find out that they're pregnant, they ring the SA pregnancy info line, and they find out and they book in their hospital, which hospital they're to go to. And the Lyell McEwin Hospital is actually in the Playford area. So when they book in to go there, we'll actually let them know about the Bright Beginnings Nutrition program then. It's a good point of call to start there because the attendance of the first antenatal appointment is generally high. So in the first trimester, 63% of mothers usually make at least one visit to an antenatal appointment during their first trimester, which is a very high number. So if we can get in early, we'll hopefully capture more participants. Then during that time, during their pregnancy, we'll be trying to incorporate the content of the Bright Beginnings Nutrition program into their appointments, and then we'll also be running our nutrition education classes. A local nutritionist will perform these classes where participants will be exposed to healthy cooking demonstrations, food preparation skills, tips and tricks on incorporating more fruits and vegetables into their diet, and we'll also have nutrition knowledge classes. So just demonstrating the effects of poor food choices and diet-related diseases, mental and social well-being, and how this is affected by food choices also. We'll assess the program by looking at community participation rates and surveying participants at the completion of the program. We'll then evaluate the impact of the program by looking at health literacy of participants before and after the program, and assess their health-related knowledge, motivation and attitudes, personal skills relating to a healthy lifestyle. We'll also evaluate the incidences of excessive gestational weight gain of participants and compare it to others that aren't attending the program, and we'll also compare it to previous statistics in that area. So it's important to note that the effects of the nutrition and dietary intervention is not short-term, so the participants would need to be evaluated over a long time. period of time to assess the success of this initiative. Bright Beginnings Nutrition Initiative could potentially prevent excessive gestational weight gain and optimise maternal health. Women who embrace the positive, healthy behavioural changes will minimise the risk of generational obesity and could maximise their own health and the health of their baby. This nutritional intervention will carry very little risk, if any, of harming women and has a high likelihood of success. Thank you for listening.